after this. Testing. Does that work? Welcome, everybody, and thank you for coming to the first in our speaker series. My name is Kimberly Sharp, and I'm the Deputy Director of Planning and Development for the City of Westerville. I've been here for 3.5 months, and I want to say this is the nicest community I've ever lived in. And it's been a pleasure. Everyone I work with is super nice and extremely helpful, and everyone in the community just really loves living here and loves being a part of this community. So we've been asked by City Council to work on a comprehensive plan for the whole community. And to start that process, we thought it would be good to have a series of speakers and community discussions, meaning what are these big things that are really important to all of us? And how does it affect our thoughts of a future Westerville? And we just thought it'd be nice to have this together. We'll be having 3 speaker series. This is the first one, Community Wealth and Health, sort of that overview of how we do what we do and how many people are here. The goal is about 20 to 25 minutes of discussion. We have 2 speakers joining us tonight. I'd like to thank Scott Ulrich with the City of Columbus, Community Healthy Places, and Nancy Reger with the Metropolitan, thank you, Nancy, MORPC. Now, she is the data person. She'll be helping us throughout the whole comprehensive planning process. So after they're done, we will have a community dialogue. The next one is April 8th, and that is sense of place. That's the topic. Our speaker is Kyle Ezell from Ohio State University. And then May 13th is the third one, and that subject is, I don't have it right in front of me, that subject is connectivity. Thank you. Other people are looking at it. So thank you for being here tonight. We're going to let our speakers get started. Just quick logistics. There is a sign-in sheet here at the end. Please help yourself to snacks. Please turn your cell phones on vibrate, and the bathrooms are across the hall over there. And thank you for being here.
Thank you, Kim. Can everybody hear me? Do I need to get closer to this thing, or is that good? Yeah? All right. Good evening. Thanks for coming out tonight. I'm amazed at the turnout. I was just telling Nancy, I wouldn't have blamed any of you for not coming tonight because it's so beautiful out there right now. Again, my name is Scott Ulrich. I'm the Healthy Places Coordinator at Columbus Public Health. And I'm very happy to be here tonight to talk about community wealth and health as part of your comprehensive plan speaker series. I have a clicker here. All right. So first, I just want to talk a little bit about what I do at Columbus Public Health and how that relates to what we're talking about tonight. So first, to understand the focus and the role of urban planning today, we need to understand where it came from. And interestingly enough, during the industrial era, American communities faced really serious health problems. And planning and public health professionals emerged together during this time to address infectious diseases like tuberculosis, cholera, and things like that. And they responded to that through improvements to buildings, streets, neighborhoods, clean water systems, parks, things like that. But over time, those professions diverged. But now, in the same way that we eradicated infectious diseases at that time, planning and public health are again coming together to address the biggest public health threats of today, which are chronic diseases like obesity and diabetes, heart disease, and some cancers. So, we asked ourselves, why not put planning and public health together under the same roof? And that's just what we did. The Healthy Places program was created in 2006. Although I've only been there just since last year, in response to mounting evidence that where you live has a profound impact on your health. The program is staffed by an urban planner, me, and a public health professional, and we work on place-based interventions to impact the rates of chronic disease in our community. And at the time the program was created, it was one of the only of its kind in the country. There were just a handful of them, of similar cases with that staffing structure, but today you're seeing more and more of it. But that's enough about me. Now let's talk a little bit about the relationship between public health and the built environment, because oftentimes that relationship isn't obvious. But again, it's becoming more and more part of the conversation. You're hearing it more and more from elected officials and decision makers, and it's really great that you're making it a part of your comprehensive plan conversation as well. So again, we need to understand that the built environment matters to health. And specifically, where you go and how you get there plays a major role in influencing your health. The design of our communities can make healthy choices easy, or they can make them difficult. And what we found is that the way we've designed our communities for the last 70 or so years has essentially engineered physical activity out of daily life. So what we like to say is, we may shape the built environment through what we build, but it in turn shapes us through the choices we make. So again, how did we engineer physical activity out of daily life? Well, again, we spent a lot of time over the last 70 years planning and accommodating cars and not for people. A lot of our older pre-World War II developed communities, you have a development pattern that looks a lot like what you see on the left there. It's compact, it's walkable, it's well connected. But post-World War II development patterns, again, embraced development that accommodated and necessitated the use of the automobile. It was sprawling, it was disconnected, and it was a really inefficient use of land, most importantly. And it looked like the image on the right. Now, there are a lot of good reasons why we developed this way, and there are a lot of reasons that we responded to what was going on at the time in that way. The problem is we built too much of it, and there are a lot of unintended consequences. And now we're responding in our own way to those consequences. And although Westerville, has a good mix of both of these development patterns, and correct me if I'm wrong, it seems like the one on the right is probably more prevalent in the community. So how has that development pattern impacted the choices we make? Well, for starters, kids walk to school a lot less than they used to, like a threefold decrease in walking to school. And people are choosing the car more, even when it makes more sense or where it should be easier to walk or bike. Trips that are less than a mile or less than 3 to 5 miles, which is biking distance. And then the consequences of those actions, those choices, have had a profound impact on obesity rates. We have a map here of the United States showing obesity rates for all 50 states in 1990. And you can see that in 1990 we had no state that was less than 15% obesity rate. Moving up to 2000, you can see as obesity rates increased, they've had to create two new categories on the map to reflect the increases, and almost half the country now has an obesity rate over 20%. And finally, in 2010, they've again created two new categories on the map in response to the increases. And there's no blue left on the map, you'll notice. So where in 1990 we had no state less than 15% obesity rate, now we have no states under 15%, and 11 states at more than double that rate, over 30% obesity rate. And we're no different here in Franklin County. We have 2/3 of our adults are overweight or obese, and 1/3 of third graders are overweight or obese. And that's because only 1/3 of the adults in Franklin County get their recommended amount of physical activity. And you're no different here in Westerville either. I looked it up in 2005, the adult obesity rate in Westerville was about 25%. And compare that to your neighbors in Worthington at 19%, Gahanna and New Albany at 17%, and Dublin at 20%. So among your northern suburban neighbors, you have one of the highest obesity rates in Franklin County. So we've doubled the adult obesity rate and tripled childhood obesity. But obesity is just the indicator, right? So some of the chronic diseases related to obesity, it's the number one risk factor for diabetes. It's also one of the major risk factors for heart disease, which is the #1 killer, not only in Columbus and Franklin County, but the country. And not to mention the all too common danger that we're all too complacent about, which is traffic crashes as a result of our built environment, which is the leading cause of death among Americans aged 5 to 35. So for the first time in history, they're saying that the current generation will not live as long as their parents, which is kind of staggering. So I'm going to throw a bunch of data at you, and I apologize because Nancy's going to do the same thing. But also a huge amount of money is directed at treating chronic disease in America. And this is money that we could be spending more productively. Healthcare costs us an average of $9,000 per person, which is higher than any other country, and we don't get nearly as much in return for that investment as most countries do. And chronic disease makes up 75% of that healthcare expenditure. Obesity costs us $147 billion annually, and if the obesity rate reaches 43% by 2018, which is what they're predicting, that cost could double to $344 billion. And just to show you, we could save $5.6 billion annually if just 10% of people joined a walking program. So that's just a very tiny bit of your time and energy with a really incredible financial impact. Some other economic consequences of this built environment. One of the often touted benefits of living in Central Ohio over a lot of other metropolitan areas is the cost of living, right? We have really affordable housing here in Central Ohio. But the traditional measure of affordability recommends that housing costs no more than 30% of household income. And you can see in the top image, the yellow area, and I'm sorry, you can't really see, it's about the same color, the 270. You can see in the bottom, it's the same as the top. The yellow area represents where housing is affordable under that 30% view. And much of Central Ohio, including much of Westerville, falls under that category. But that benchmark ignores transportation costs, which are often the second biggest household expenditure after the actual housing costs. And when combined, they say that housing and transportation should make up no more than 45% of household income. And when you look at the bottom image, that's where they've combined housing and transportation costs. You see a lot of that yellow turns into blue, which is unaffordable, including much of Westerville. I don't know if I have a pointer on here. But I don't know if you can see that little blip there in Westerville is right around uptown Westerville. So you can see a correlation between the way the built environment, the pattern of the built environment and housing and transportation affordability. And we believe that the built environment and physical activity can make a difference in health, and research shows that it does. Research has shown that physical activity can even be more effective than prescription drugs at preventing and curing chronic diseases. And so it's even more important that policymakers, engineers, and real estate developers do more to change the built environment, because we can change people's health with what we build, and that's why we're here tonight. So we've talked a lot about the problem, but what about the solution? What does a healthy community look like, and what can we do through the comprehensive plan to improve it? Well, comprehensive plan presents a real opportunity for you to address health through a wide variety of strategies. And since health and wealth are both outcomes of a plan, it's impacted by all of these elements of a typical plan. And so we always advocate that all policies, we take a health through all policies approach to planning, rather than isolating wealth, economic development, or community health as a separate focus. If you make it an overarching plan or overarching goal of the plan, then it permeates through all of the strategies and policies that come out of the plan. And healthy community design means building compact communities with housing and transportation choices near jobs, services, and schools to support local economies and protect the environment. Diversity in housing size, type, and cost are important, as well as a balance between housing and jobs to reduce the need for long commutes. And neighborhoods with nearby destinations that people can bike or walk to have been shown to support a healthy lifestyle. But not only does it support health, this type of development usually costs about 1/3 less for upfront infrastructure, such as roads, sewers, and water lines. It also saves an average of 10% in emergency services like police, fire, and ambulance services. And it also generates about 10 times more tax revenue per acre than conventional suburban development. And if it wasn't obvious enough, living near parks and recreational opportunities also improves health and leads to higher levels of physical activity. Communities designed for active living feature places like greenways, multi-use trails, playgrounds, pools, and other recreational facilities that encourage exercise. But more importantly, programming these spaces with activities to get people moving can also support a culture of healthy and active living. And we really emphasize that you need to complement the policy and built environment change with culture change, because it's almost like we have to retrain people to use the spaces that we create for them. And it also shows that parks also spur economic development by attracting home buyers and boosting residential property values around them. Complete streets also add to healthy communities. Complete streets are for everyone. They're designed and operated to enable safe access for all users, including pedestrians, bicyclists, motorists, and transit riders of all ages and abilities. Walking is the most common form of exercise for most people, and when trips are within 1 mile, 40% of people will walk. And bicycling is actually the fastest growing form of transportation in the United States. Most non-commute trips are less than 3 miles in length, and that means that any of those trips can be shifted to bikes if the infrastructure and facilities are available and people feel like it's socially supported to do so. And as far as transit goes, steady growth in transit across the United States, maybe not in central Ohio, and transit users tend to be healthier and get more exercise. And people want to live and work in places where transit is an option. But ultimately, complete streets are about providing choices, and these days that's what people want. And not only that, but there are significant economic benefits with complete streets as well. We've seen $34,000 increase in value for homes located in areas with above average walkability, a 10% premium on real estate prices based on proximity to bike lanes. We've seen that bicyclists, pedestrians, and transit riders spend more at everything except supermarkets. They're not necessarily going to walk to supermarkets and get a huge load of groceries, but they tend to spend more at other stores. Businesses tend to want to locate in walkable areas because their employees are more productive when they're healthier and happier, and these places can spur innovation by providing closer connections to partners and clients. And finally, bicycle and pedestrian infrastructure not only costs less to build than expanding roadways and building highways, but they bring greater returns by employing more people to build them per dollar and creating more value on the real estate that it touches. So even if you yourself don't want to use these facilities or don't feel the need for these facilities, the people who are going to buy your homes and the people who are going to move to your community will want them. And they will pay a premium for it. And Westerville is well positioned to take advantage of these trends if you provide the options that are being demanded now and well into the future. And almost done here. Complete streets are also related to the concept of aging in place, which is an approach to providing an environment and services that allow people to live independently in their own homes as they age. The majority of people over 50 want to stay in their homes as long as possible. The problem is most of them can't because they can't drive. And so improving community mobility for people who have limited mobility and either choose not to drive or can't drive can help people age in place. And the big takeaway is that improving communities for seniors improve conditions for all because they have the same needs as children, as the disabled, or any other of our most vulnerable transportation users. And it's not just about physical activity, it's also about nutrition. Healthy communities thrive with access to healthy food through a variety of places. Increasingly, actually, I'm just going to try and get through this real quick. We're not seeing housing developments that are centered around golf courses anymore. Some of the most innovative housing development designs we've seen lately are actually around farms and communal gardens. And so one thing is for certain, if developers are providing it, they wouldn't be providing it if it didn't make economic sense to do so. And if doing so makes their developments more marketable, you can be sure that it'll improve your property values as well. And finally, air and water quality are also important for health. Communities can help improve air quality through development policies that can reduce driving and supporting efforts to build complete streets. And also, stormwater can often overload old sewer systems that are based on the combined stormwater and sanitary lines. It can be very costly for cities to address this problem. The city of Columbus is actually spending multiple billions of dollars on their wet weather management plan to do this, but one bright spot in that is green infrastructure. Natural stormwater management areas that use plants and soil to absorb and filter water benefit public health by improving air and water quality and can save money. So balancing the conventional gray infrastructure with green elements can accomplish the same water quality goals while spending less and getting all kinds of added benefits like more green space and more attractive streets. So just kind of taking away, what we've seen is that the same type of choices and investments that support community health also have a clear correlation with creating value and building community wealth. And the choice is yours, and the comprehensive plan is really your opportunity to make that happen. So,
Thank you.
Thanks. Sorry if I went too long.
We're going to have one more speaker, and then we're going to open it up for questions to our presenters.
Good evening, everybody. I'm Nancy Reger. I'm with Mid-Ohio Regional Planning Commission. I'm the director of the Data and Mapping Department at the agency, and I've been at MORPC for over 27 years, so I know Central Ohio like the back of my hand. I wasn't born here, but I live here, and I've lived here a long time. MORPC, I'm going to just do a quickie about what MORPC is about. I've got to figure out how to do this guy. How many of you are familiar with Mid-Ohio Regional Planning Commission? Oh, okay, then I can do this quick. You know it's a voluntary organization of governments, and we have a number of purposes that we serve. One of the main things we do, we're a regional voice for Central Ohio. The local governments come to MORPC, work together on various ideas and projects and concepts, and MORPC tries to move those forward through our State House and actually all the way to Congress. We also are a great source for data. If you ever need any information, just call me. I call myself misinformation, and that's sort of a joke if you get it. But as I said, we have a lot of information. We also are transportation funding for the Central Ohio area. Big road projects, big bike projects, transit, all transportation that uses federal dollars flows through MORPC. And finally, we also do planning for the environment, for energy, for regional kind of scope concepts, and we also have some specific project or programs that address weatherization in houses and home repairs and foreclosure counseling, so some real specific things. Okay, now we're going to get into Central Ohio. This is the Columbus Metropolitan Statistical Area, which basically is the commuter shed of Central Ohio, and it's 10 counties big. The Office of Management and Budget in Washington defines this every 10 years. It's 10 counties big. You'll see some kind of oddballs down there in the fringes. Morrow County, a lot of people commute from Morrow into Delaware. A lot of people from Perry and Hocking commute from their counties into Fairfield, and because of the strong relationship of Fairfield and Delaware County to Franklin County, they all get clumped together. But within this region, there's almost 2 million people. It's the 32nd largest metro area in the United States. We fit right in between Las Vegas and Indianapolis. So I got a few factoids here for you about Westerville. And these next few graphs, these are, they all look similar, but they're in order of lowest to highest. Westerville is always darkest. And Columbus is not on this graph. As I mentioned, the region has about 2 million people. Columbus City itself has over 800,000 people. So if I'd put it on this, everybody else would be super teeny tiny. So I didn't put it on this one. But Westerville, of all of these cities, and these are the suburban communities within the core of the metro area, Westerville is the second biggest suburb. Dublin's the only one bigger than you. So you're about 37,000 people. And by 2035, because one of the things we do at MORPC, as I mentioned, is transportation funding, in order to do our planning and work with our communities of where the need is going to be, we do projections of population and employment, working with the state of Ohio and working with all our local communities in doing that. Westerville is anticipated by 2035 to add another 9,000 people to this city. So I think there was a question Kim was thinking about asking about where those people were going to go. So that's something for you to think about. So you can see Westerville is no longer the second biggest city in 2035. Now you've been surpassed by Reynoldsburg, Grove City, Delaware, and then Dublin is still there. But these are projections. These are kind of a prove me wrong thing. They're for the year 2035, so it's pretty far into the future. But you have to kind of get a feeling or a gauge of what's coming in order to be prepared for it. In terms of home ownership, regionally, about 61% of the people that own their houses, whereas in Westerville it's about 73%, and you're just about right in the middle of all of those cities. And Columbus is now in these charts. One more, income. This is median household income. These are 2012 numbers. So from the metro area perspective, almost $50,000 a year median household income. Westerville, almost 80. Again, you're pretty much right in the middle, and I don't know if you notice this. Whoopsie, rats. There it is. Oh no. This guy. I don't know where the, is that the lighter thing? I don't know where it is. But New Albany is such an outlier. I mean, it used to be Dublin was the super outlier, but now New Albany, they just are above and beyond. Like $160,000 a year. I mean, it's twice of Westerville. That's, it's always surprising to me. They just turned into a city after this census. Median age. Columbus area is actually pretty young, only about 35 years old. Median age. Westerville again is a little on the upper end of that at 38.3 years. Younger than Ohio, older than older than the U.S. That's what it is. And then keeping up with the age concept, have you ever seen population pyramids? These are kind of a cohort. Every line represents 5 years of people. Starting at the top are the children, the bottom are the seniors. Westerville's on the left, the region is on the right. And the thing to notice about this is that Westerville kind of goes like this. The bulging out at the top, that's kind of Otterbein. I mean, it's kind of inflates your young adult population. But then as you go in and then out again, those are the baby boomers. Those are the up and coming empty nesters. And if you just kind of imagine that thing sliding forward 20 years, they're going to all be down towards the bottom there. So that's something that's coming that you really need to be aware of in your planning in terms of attracting young people and making sure you're ready to deal with the fact that there's going to be a lot more seniors. In fact, in the past 20 years, in the region, added 50,000 people that are over 65. That doesn't mean 65 or 50,000 people moved here. That means people just, shifted in their age. And so then looking forward to the next 20 years, 150,000. So it's 3 times as many. We're just sorry, you're older now than you were when you came in. We're just getting older. Also, the region is increasing in diversity. you know, as I was looking at things, I always know some of this stuff in terms of a quarter of the new population that is grown in Central Ohio, a quarter of it is from international migration, people coming here from other countries. Used to be 1 out of 12 people didn't speak English or wasn't their first language, and now it's 1 out of 10 people. But in the Westerville City School Districts, 10% of your kids are relying on English proficiency coursework. So I understand that Westerville Schools does not equal Westerville City, but it does equal this part of the community, and you know, it's part of your culture. And as Scott alluded to, in terms of demographics, preferences are changing. He'd mentioned the desire of people to not live always where they have to use their cars all the time. And there's sort of two big populations of that. There's the up-and-coming empty nesters, where people like me are not going to be driving forever and want to probably live close to places where I can walk to or get to without having to rely on my kids to drive me around, because they probably won't. And then also there's younger adults that it's just the desire is to live in a different pattern, and it's a true thing. And so it's just, as you're doing your planning, being aware of those two giant populations and plan accordingly. Okay, this next couple slides I have are in regards to employment. And this chart is regarding the people that live in Westerville. What do they do for a living? And as you look at that, you might notice that the health and education lines, that the top line is the region, the bottom line is Westerville. More people in Westerville work in that profession than the region average. Also, there's fewer retail workers, and this isn't people that do this for a job. Fewer people that live in Westerville work in the retail industry than the national or the regional average. And then this pie chart is what kind of jobs are in Westerville. So it's not what people do, it's what jobs are here. These are numbers that MORPC puts together from the jobs and family services data that we get, so it's not as detailed. But about half of your employment is actually office, and then the other half is split up into 3 pieces. I just see my boss standing over there in the corner. He lives in Westerville, and he showed up. I was hoping he wouldn't come, but he did. Okay, these are the good maps. So this map is showing where do the people that live in Westerville, where do they go to work? Where do you guys go to work? A little less than a third stay right here in the city to do their job. But then you can see, and I wish I could figure out how this thing worked. How did you make the red light show up?
It's in the middle.
And I can't find it. Anyway, so the darker colors are where there's a higher concentration of where people go. So you can see in the northwest, Dublin, downtown, Easton, and then kind of up around the Polaris area. So there's a smattering all over the place, but those are the highest concentrations of where people that live in Westerville go to work, whereas this map is showing where people come from that work in Westerville. So again, about a third of Westerville jobs are filled by people from Westerville, and then you can see that northeast, everybody from this kind of your travel shed is that northeast area. Apparently everybody in Harlem Township, I'm guessing, must come to Westerville to work. But then there's a good number of people from Dublin, and then smattering Hilliard and Reynoldsburg, Gahanna area, Liberty Township. But you can see where you're drawing people from. So again, because we do projections for transportation and for planning purposes of people as well as jobs, by 2035, expect about an additional 25 or 5,200 jobs in Westerville. There's about 27,000 jobs here now. And so as you look at this, you can see some of the other communities around Central Ohio are expected to add a few more than Westerville, but you guys are pretty balanced. It's a nice look into the future. So again, I want to compliment you on your planning. As I mentioned, I've been at MORPC for a long, long time, and Westerville and Grove City and Reynoldsburg are the three kind of big communities that do not have community-wide comprehensive plans. And when we do our work to try to put all of these pieces together, it's really helpful to have that comprehensive view at the local level, so that when we try to mush everything together, we're using your goals and your values and putting those numbers into, or putting that data into numbers. So if you don't know where you're going, this is in honor of spring because it's almost baseball season. If you don't know where you're going, you're going to end up someplace else. So get it in your head of where you want to go. And for those of you who are in your 30s or have kids in your 30s, you might recognize this quote from G.I. Joe. One of my favorite quotes is, "Knowing is half the battle." Because if you've got your grounding, you've got your base work done, you know what you're going to do. So as I mentioned, I've been in Central Ohio a long time. I know this region. Every community is unique. Every community is special. Identify those things that make you Westerville and hold on to them. I mean, not every place has an Otterbein. Not every place has an Uptown. You guys have some really good stuff here, and you should take advantage of that and preserve it and use that as you move forward through your planning. And I almost got it done in time. You bet.
I don't know if we could drag one of the mics. Does that one come on? Yes. You want to take that back with you?
Sure.
So just briefly, we are going to make both these presentations available on the website tomorrow. www.westerville.org. On that front page is a comprehensive plan. I want to say square, clicker, tab, right on the front. Just click on that. We have a comprehensive page. We're starting to add things to that page. These presentations will be on there. So I want to take a few minutes and allow you to ask questions of the speakers, kind of ask for some clarifications, and then we're going to open it up to the audience. I have some specific questions I'd like to draw from you and get some ideas from you. So are there any questions you have for either Nancy or Scott this evening? I'm going to come out like Donahue. Mr. Hayek, you might have to use that. Do you want me to come to you with the...
I think I have a big mouth. Your slide, Nancy, the MORPC slide on Westerville,
Yes.
where we kind of collapse on 20-somethings.
Yes.
Is that prevalent with other suburbs? Our housing stock doesn't address the 20-somethings. And is that prevalent in Dublin and Walkley Road?
It is. Columbus is kind of special because of Ohio State. But the interesting thing about that population group, there's not a whole lot of that. There's a kind of a down back there. There it is. It's those 30 to 45-year-olds. There's not a lot of them. It just happens if you look back in history. That's when a lot of changes were happening socially in terms of women entering the workforce, people having less kids, birth control becoming more available. And so, quite honestly, a lot of those people aren't here. But the ones that are here, you need to make sure you keep hold of them because they're having the kids that are going to keep you going. So it's just kind of one of those quirky things in demographics.
Part of the demographic dip, so I've got a quick question. How are we positioned to actually take advantage of where we sit now versus where we could want to be, where we could capture that? Because there is a certain, Columbus has a certain cachet that draws 20-somethings in. How can we take advantage of that and start to develop some of that cachet ourselves?
You want me to answer that?
I can
Yeah, that's...
It,
That was more of a question for Mr. Ulrich.
yeah. I mean, it got to a lot of the things that I was talking about. We commonly refer to that group as the millennials, age 18 to 34, and I'm trying to grasp at some data that wasn't in my presentation. Something like 68% of millennials want to be near parks and recreation. I mean, everything that I discussed applies both to the baby boomers and to the millennials. Like Nancy was saying, that there's a lot of similarities between those two groups, whether it's exciting urban neighborhoods and commercial districts, mixed-use districts, whether it's parks and recreation, whether it's complete streets and alternative transportation opportunities. But I see Nancy grasping for the...
There's Westerville is kind of two cities. There's Westerville that's developed, the old Westerville, and then you've got that giant thing up north. And so there's an opportunity there for when that develops or how that develops to do it in such a way that it reflects the city that you want it to reflect, to be attractive, because not every suburb actually has land left to develop, or they maybe have land to redevelop, but I really can't see Westerville redeveloping their neighborhoods too much. I mean, they're pretty nice, so there's really no reason to. But it's just keeping that in the back of your mind as land planning occurs.
I have a little bit more.
Well, still more.
I didn't know there was something I meant to say and I forgot. Between Columbus and its suburbs, Columbus has things that maybe its suburbs don't have, but its suburbs have something that Columbus doesn't have, which is a great school district. And so here in Westerville, you have that great asset. What you need is the other pieces that Columbus has, which are those interesting parts.
I'm going to grab a couple more
Yeah.
questions. Sir, I'm going to ask you to speak into the mic if I can hand it to you.
I'm loud enough too.
Well, it's because of the recording. We're recording this.
I'm just curious because, if you look at those age profiles there, there are a great deal of needs or desires from each of those groups. Can you really put together a plan that accommodates all of them, or do you need to first identify which groups you want to accommodate and then develop your plan?
I don't think you can accommodate everything for everybody.
Right.
But it's more than anything, it's recognizing that and being aware of issues, so that as you're working forward, you at least have it planted in your head about thinking about it. There has to be choices. I mean, sometimes I don't have anything against people living on 5 acres, I mean, if that's what they want to do, that's fine, as long as the opportunity is there for them. But then also recognize that not everybody wants that either. So it's just kind of balancing all of those ideas.
Good. I wanted to hear that. I couldn't see how you could do it.
Another question? No? Okay. Scott and Nancy, thank you very much. If you want to stick around, thank you to the speakers for coming tonight. We have about 15 minutes. We're going to do an exercise from the audience. First of all, we're going to try to find some action words, but from you, what tonight was shared that you either found surprising, exciting, or shocking? Got to get someone to get us started. We're the second largest suburban community in Central Ohio.
That doesn't include Newark. Okay. I had to draw the line somewhere.
Sir? So the prediction of MORPC is that Westerville will not remain the second largest suburban community in Central Ohio. Exciting. Walkable communities increase property value. I'm summarizing it on the microphone for the... Sir?
I think the challenges we face as a city are the same things that corporate America struggles with. So we talk about
I'm glad you brought that up. Something we suggested to City Council is we look at this comprehensive plan as a business plan for the city of Westerville, maybe just as a comparison. What else was said tonight that you found surprising? Sir?
I think the issue of where people in Westerville work, who works in Westerville, because I've always been concerned about, seeing that northeast moving there, of how much traffic and that has to move through Westerville on a daily basis. So,
A lot of people are coming from A and going to B. Some are coming here and leaving here, and a lot of people are driving through. Okay, anything else? So from what you heard tonight, the next thing we're going to ask is some of these things that surprised you, the number of people, how we fit into the larger community, walkability, the need to increase diversity in various modes. How do you think that's going to affect us as a community? What do we as planners, council members, planning commissioners, what do we need to be thinking about as we even begin this process of a large comprehensive plan? Sir? Well, then let's start there. That's good. We're going to possibly have about 9,000 more people in the next 20 years, more or less. 9,000 more people, 9,000 more households. Where would you even begin to have 9,000 more people live here? How many apartments? How many townhouses? How many single-family homes? And how do you increase? Well, 9,000 people doesn't mean 9,000 households. 9,000 people divided by 2.6 is what? 4,000 households? If someone could do the math quick, more or less. So 4,000 more houses, apartments, and townhouses. Where would you put 4,000 more housing units? Where would 9,000 more people live? That's what we have to think about. And we're not going to make a map in the next year that says 20 people will live here and 400 people will live there. We can't do that, but we can say these areas make sense for growth, and this is why. These areas make sense for redevelopment and additional growth, and this is why. These areas will pretty much stay the same, and this is why. We need to kind of outline where it makes sense in our community to encourage growth, and then what type, and thinking about how many we're going to need. If our whole community developed with only single-family homes, and we haven't done this math, we'll have to do this math, right? If all of whatever land is left, a portion of that, say 20% of the land that's left to develop, was devoted to single-family homes, how many homes would you get? I'm sure it's not 4,000. So, yes, Mr. Hayek.
The most surprising, actually the most disappointing, is that from a jobs perspective, we're only going to grow by about 15%. According to extrapolations. And if we continue to develop offices like we have developed offices, that's probably the right time. We really need to think about, particularly in outdoor, parking. The parking is the limitation. Certainly not everybody's going to drive from home. But the idea of a parking deck so you can get more office, more jobs. For 15%, that's our limit. That balance.
We can ask a clarification from Nancy, but I believe those projections are based upon past trends, not upon any big plans you may have for the near future, right?
No. When we do our projections, we base them on local plans as we know them. So if you put something together that's different from what we know now, then as we do our next set of forecasts, because these get updated every 4 years, and they change. So if there's something way different than what is anticipated based on what we know now, then those will be adjusted. That's, again, I want to reemphasize, those are projections. They are not foregone conclusions by any stretch of the imagination. I do them. This person right here. So there's opportunity for moving things around, but bearing in mind that as that happens, there is a with more jobs comes more revenue, potentially more traffic. So it's thinking about all of those pieces and parts. But as I said, this is what we have right now on the ground based on what we know about Westerville. So does that answer your question?
If you put a gun to my head and said what the job growth would be, I'd say about 50%.
Did you say
Mr. Hayek said
50%?
50% would be his projection. Is that what I heard you say?
I'll have to tell you another secret about the projections. I have to tell you another secret about the projections. We start with population growth and then break that down to labor, available labor, and then to jobs. And there's a controlled total number of people that are expected to come to Central Ohio. So we have to share all those people and jobs around the region. So if Westerville makes itself so incredibly attractive, more attractive than it currently is, then we factor that into the work that we do. So it might very well be that way, but right now, because of the actual, there's a balancing act that occurs, that the Dublins of the world are doing lots of things in order to attract more businesses over there. Rickenbacker's doing a lot of stuff to attract workers. Columbus is doing a lot of things to attract workers. So it's an art and a science to put these together, but we really try to make it right based on what we know and what we have.
So maybe we move the, oh, ma'am. The question was, do you feel that sustaining our excellent school system is part of the equation of having this healthy community? And I think most everyone in here would say, and bringing new families, yes. The school system, is that saying, what's your growth or decline in the last few years? Enrollment is declining. Okay. I've heard it, we've had a few public outreach meetings, and a school system, an excellent school system is definitely usually a part of that discussion. It's always a part of the discussion. I'm glad you're here tonight. We have about 5 minutes left. I would like to hear your thoughts on what do you think a healthy Westerville means? Thinking of physical health, mental health, socially healthy, fiscally healthy. What does a healthy Westerville mean to you? It's our park system. Mayor? Say it, just the first line again.
Balancing the job population, our business population, with our housing and our parks, that type of thing. Just balancing all those different aspects that make a healthy community.
Good, thank you. A healthy community, a healthy Westerville. What does that mean to you? We just need a few more to fill out the sheet.
Pedestrian bikeways are much more defined than just the if I have a car, I go this way on Main Street, I go right on West, and go to that kind of line, whatever. You can't say the same about bikeways. Go on the bikeway next to kind of like where the turn
active community, out and about. Julie? Did you get that, Bassam? Housing options, transportation options, activity options, job options. Sir?
Yeah, just there's in communities like 7 or 8 dynamics just moving together like nursing towns, but they always include a very active dynamic faith community. I think research is beginning to show that.
A dynamic faith community. Amy? Smart spending. Easily and locally. Otterbein is part of our healthy community. Say that again, Mike. Rivers and waterways. Air quality, water quality.
Choices for activity, because very honestly, I could care less that we have a bunch of bike trails. So the fact that I have access to
Activity choices, indoor, outdoor, 4 seasons. All right, this has been pretty good. We're going to type up these notes too. They'll go along. We won't have them typed up tomorrow and on the website, but we'll have the presentations on the website, and then we'll type up the notes. They'll be up there in the next few days. I want to thank you very much. This was a really good start. These are the big ideas we have to think about as we move forward. The plan kind of boils down to, yes, land use and transportation, but all these other things influence it, and all these things are influenced by how we make land use and transportation choices. So thank you very much. Council work session does start at 7 o'clock tonight. There are 2 things on the agenda. Council will be rough drafting some guiding principles for the comprehensive plan, and then I believe Randy and or Mike is presenting the Parks and Rec and Open Space Plan to Council tonight. Thank you very much for being here.